Let's take some body substance isolation. Insert your oropharyngeal airway after you measure. And you have Jess come over and ventilate the patient, or pre-oxygenate the patient. Go, Jess. When you show, she's going to pre-oxygenate. Zach's going to stand in front of the camera. There you go. She's going to do this for at least 30 seconds. You know, there's no gag reflex, so now, Zach, you're going to check the cup. Put about 60 milliliters of air into it. And now you're going to check the integrity of the balloons and pull the 60 cc's out. Once that's done, you're going to leave it at 60, your syringe. At this time, you could possibly suction if there's any broken teeth or obstructions in there. You can act like you're lubricating the tip. Okay, now have her step aside, and you're going to position the patient in the neutral position. You can pull the airway out. Once the airway is out, non-dominant hand, you're going to hold the mouth open, and using a lateral approach, introduce the tube into there, so from the side. And you're going to put it all the way so the yellow is to the lips. Now you're going to put it to about, you're going to put about 60 milliliters of air in there. Now you're going to give her the stethoscope and she's going to listen.
Oh, sorry.
And now do this and you're going to ventilate. Now pull back. You're going to pull back in the tube until you get ventilate. Do some more. Ventilate. A little bit more. Ventilate.
More.
I think that's good, huh? Did it fill the lungs?
I don't see the lungs going off.
Go down a little bit. Is there any point?
They're moving a little bit. Yeah, they're moving.
Go a little bit more. There we go. At that point, we will just reseat it. Okay, let's do this one more time. Just deflate it. Okay, so take BSI. You're going to insert a simple airway adjunct. Cross finger technique. Now again, Jess is going to come over and ventilate the patient. And she's going to do that for about 30 seconds while you are getting your equipment ready. You've already looked at your chart. Your chart told you that you had put about 60 milliliters of air in there, so you're just going to fill the cups up to that point to make sure that the integrity is good of the cups. So you do that, check the pilot balloon, and then check the two cups. Now deflate the 60. All deflated. At this time, you would lubricate the tip as well. So you could lubricate the tip. Then, if there was anything in the airway, we'd make sure that we'd suction it before we place this. So we've got our syringes ready. Tip is, now you're going to have her step aside and have her pull the oral airway out. She takes it out. Now you come, patient's in a sniffing position, you come from lateral to medial. Using cross finger technique, and you're going to put the hub right to the lip line. Now with the yellow one here, we're going to inflate with 60. Now we're gonna attach the bag valve mask. And we're gonna inflate until we get chest rise and we get lung sounds, and we're able to ventilate free with not a lot of bad compliance. So pull back. Now there we go. That's probably the best as what we got. Now we're getting so now you'd start check stomach sounds. And then both lung sounds again. Now put the extra 10 to 15 milliliters of air from the syringe into there. Just to seal it. And now continue ventilating. And then you could reassess if you need to. If a gag reflex came back, direct your partner to sit on the side with you with the patient, because you're going to have to do them after you deflate the cuff. So you contact medical control if you need to. Prepare your suction equipment. Deflate the cuffs. Remove the airway. As he does that, you can tilt him so towards the camera then. And then suction as needed. Perfect.